Hello everyone, this is Sir Steven, and this is the introduction to normal histology and basic histological techniques. This is the part 1 for our medical histology series, and let's start. Before we fully understand and before I go use some of the micrographs, figures, and histological slides, you must be able to learn some of the terminologies, the definition of a cell, organelles, the overview of cell organization, such as the membrane-bound organelles, non-membrane-bound organelles, extracellular elements, the nucleus, including the chromatin, the chromosomes, the nucleolus, and some of the cytoplasmic interactions. The cytoplasm, such as the endoplasmic reticulum, the Golgi apparatus, the mitochondria, lysosomes, cell membrane specializations, even the cytoskeleton with the thin and thick filaments, the microtubules, the intermediate filaments, the centrioles, cell adhesion, the desmosomes, the macula adherens, hemidesmosomes, the basal lamina, and collagen for our extracellular substances. So our first image, this is a depiction of an organelle distribution within a cell that shows a basally placed nucleus, which is pointed with the arrow, the mitochondria, the endoplasmic reticulum, and the variably sized granules. So these are composed of mucin or other proteins. On your right is the endocervical cells from a pap smear that shows a typical cellular organization with the basal nucleus, a variable chromatin clumping, a terminal var. It has a cilia, it has a granular cytoplasm, and it will show you the vacuoles. The Golgi in blue has a mucin droplet formation. Next is the nucleolus and the nucleoli. On your left, this is a touch imprint from a seminoma of the testis with a cluster of tumor cells and a background lymphocytes. This demonstrates a well-defined enlarged nuclei, each with at least one prominent nucleus. That's showing you on this arrow on your left. On your right, this is the nuclear membrane that appears as a single linear structure on this electron microscope. There is both heterochromatin in blue, the outline. They are clumped along the nuclear membrane, and the euchromatin, which are dispersed, the latter reflecting metabolic activity. The central prominent nucleolus is composed of filamentous nucleolunema. Next image is your unit membrane. On your left, this is a high magnification EM of the nuclear membrane, which demonstrates a trilaminar structure with two fine parallel densities which are separated by a lucent region. The top one half of the image is represented by heterochromatin on your right. This is a diagram that highlights the nuclear cytoplasmic communication that occurs through the following structures. Number 1 is your nuclear blebs. Showing you in this white arrow is the nuclear pores. In the black arrow, this is the communication between the perinuclear space and the rough ER. In your blue, this is the dissolution of the nuclear membrane during mitosis. Next image is an EM that shows that there are several lymphoid cells in the various stages of activation. A mature lymphocyte in blue arrow. This one is in the lower right. Each of the remaining nuclei has a prominent nucleolus. The nuclear membranes of the two center cells are convoluted, and they show occasional thin circular extensions, such as this. And they are entrapping your cytoplasms. Okay, this is the mature lymphocyte. These two are your circular extensions. On your right is an opposing membranes of the endoplasmic reticulum that create a flattened compartment for protein synthesis. These are attached external granules are what we call as your ribosomes. Next image is on your left, a touch imprint of a cluster of reactive plasma cells that shows the displayed clock phase nucleus, which are adjacent to a cleared area of cytoplasm. This is HOF that correspond ultrastructurally to the location of the Golgi apparatus, your mitochondria, and assorted organelles. The basophilic cytoplasm on your left corresponds to the distribution of the rough endoplasmic reticulum. On your right is the EM of a mature plasma cell And the area next to the nucleus is occupied by the blue curved arrows, the mitochondria. Most of the cytoplasm is occupied by flat cisterns of the endoplasmic reticulum, which is we can see in your bold blue arrows, such as this. Next image is the EM on your left, showing that in the perinuclear area of this plasma cell, the nucleus, pointed by the arrow, is opposed to flat cisterns of the Golgi apparatus, all of which are surrounded by flattened rough endoplasmic reticulum. On your right, this portion of a cell periphery on EM shows convoluted plasma membranes. The black arrows are scattered intracytoplasmic ribosomes with blue curved arrows, some of which attach to the rough endoplasmic reticulum. Next image, in this portion of an adrenal cortical adenoma, the tumor cells on your left have abundant foamy cytoplasm reflective of a prominent smooth endoplasmic reticulum. On your right, this is an EM that shows a portion of the adrenal cortical tumor cell with cytoplasm filled with rounded, clear spaces of smooth endoplasmic reticulum. Note that the large nucleus in blue bold arrows, such as this, with dispersed chromatin and a part of the prominent nucleolus, such as this. This is the nucleolus. The prominent smooth endoplasmic reticulum are correlated with steroid production. On your left is a salivary gland lobule with two ducts surrounded by acini with cytoplasm. These are the arrows in blue. They are filled with enzymatic granules, which is indicative of an active Golgi system. On your right, the EM shows an acinar cell with a basal nucleus and apical, variably sized granules of heterogeneous electron density. This is flat endoplasmic reticulum, the rough ones, surrounding the bottom and sides of the nucleus. Basally, there are numerous folds of the plasma membrane abutting the stroma, and they are being outlined with a basal lamina. On your left is secretory granules that may contain mucin or digestive enzymes, be lysosomal as in lipofuscin, or be specialized. These granules have a scroll-like structure and are characteristics of your mast cell. On your right is the juxtanuclear collection of a neuroendocrine granules that's coming from a paraganglioma. These granules, small granules, contain mixtures of peptides and amines. There are a centriole in blue adjacent to the cluster of granules. On your left is an AM showing the portion of a cardiac muscle cell containing a paranuclear clusters of variably sized dark membrane-bound granules. Histologically, these granules are brown and similar to those seen in the liver. On your right is the EM shows several tumor cells from a granular cell tumor containing intracytoplasmic granules. They are variable of size, density, and internal complexity. These are the characteristics of your lysosomes. On your left is an oncocytes. The cells of an oncocytoma have a granular eosinophilic cytoplasm reflecting of numerous intracytoplasmic mitochondria. On your right, the EM shows the cytoplasm is filled with mitochondria to the exclusion of most other organelles. The internal substructure of the cristae is clearly visible. Next is, on your left, a section of liver stained with PAS before diastase digestion that reveals scattered fat globules and intracytoplasmic brown pigment such as your lipofuscin. That's coexisting with the numerous dark staining glycogen granules. On your right, an EM showing the liver cell containing numerous mitochondria, dispersed granules of glycogen, and scattered globules of fat. Glycogen granules may occasionally be confused with your free ribosomes. On your left is a normal skeletal muscle that demonstrates peripheral elongated nuclei in black. On your blue arrows, these are typical cross striations of the cytoplasm which are present. On your right, an EM showing that the skeletal muscle cytoplasm is organized into a dark Z bands, which receive thick and thin myofilaments which are responsible for contractile function. These correlate directly with the light microscopic striations. Next image on your left is a smooth muscle cell that demonstrates an elongated nuclei that are blunted at the ends and have an occasional transverse lines perpendicular to the long axis. On the blue arrow, these are reflecting deep nuclear folds. You will see overview of the cytoplasm, which is fibrillar and eosinophilic. The cell borders are distinct. With your EM on your right, it shows a smooth muscle cell again with a corrugated nuclear contour. In your blue arrows, you will see the corresponding to transverse lines histologically. The cytoplasm is filled with fine actin filaments and dense bodies. The collagen fibers are extracellular. Next image is on your left. On EM, the edge of a smooth muscle cell shows actin filaments parallel to and inserting on the plasma membrane. These are arrows on your single arrow, from which the pinocytic vesicles invaginate in your bold arrow. Thin basal lamina parallels the plasma membrane. On your right is a tulidine blue stained tangential section through the mid-epidermis, which demonstrates a stratified squamous epithelium with numerous intracellular bridges. On your left, an EM that shows the cytoplasm of this squamous epithelial cell filled with wavy fascicles of the tonofilaments inserting the desmosomes. Cytoplasmic extensions of these complexes form your intercellular bridges. On your right, this high magnification EM shows an intercellular bridge consisting of a central desmosome, which are showing in your blue arrow, which is a thickened opposing segments of plasma membrane and a central intervening linear density, onto which wavy tonofilaments will insert. Next, on your left is a tulidine blue stain shows glandular epithelium of the small bowel demonstrating mucinous vacuolization. This is on your black arrow. And a dense apical terminal bar, this portion. On your right is the apical region of several adjacent glandular cells of the small bowel, which is visualized by EM. The terminal bar by light microscopy is represented by numerous microvilli anchored into the apical cytoplasm by your thin filaments. The cells are joined by desmosomal complexes. On your left is an EM that shows a glandular lumen formed by several salivary gland acinar cells and filled with microvilli. This is shown you in your black arrows. A secretory granule is present, which is shown in this arrow, this single arrow. The apical portion of the cell is held together by junctional complexes pointed by this blue arrow on your right. The right image is a cilia, which shows a portion of two ciliated respiratory epithelial cells. Your cilia are have modified centrioles with the same tubular substructure. They are anchored into the cytoplasm by angled striated blepharoplasts, shown in this arrow here. On your left is an EM showing a thin-walled capillary lined by the endothelial cells. A thin single layer of basal lamina, such as this and this, surrounds the runs parallel to the outer plasma membrane. We have also collagen fibers here, such as this in blue. in varying stages of cross-section are in the stroma. On your right is an extracellular collagen fibers exhibiting the characteristic periodicity of 64 nanometers, which is visualized by your electron microscopes. On your left is an epithelium. This epithelium consists of sheets of tightly bound contiguous cells that cover the external surface of the body and line the internal surfaces. Epithelial cells are bound to the underlying connective tissue by a basement membrane. On your right is a cilia pointed by these arrows. They are motile, hair-like projections on the surface of some epithelial cells that are used to propel substances along the lumen, as seen here in your bronchus. Next image is your simple squamous tissue. On your left is the mesothelium, blue arrow, consisting of a single layer of squamous epithelial cells. On your right, the epithelial cells are anchored by the underlying stroma. Next image is your stratified squamous. On your left is the stratified squamous epithelium, which consists of multiple layers of polygonal squamous cells. These are seen in your esophagus. The stratified squamous epithelium is non-keratinizing because the top layers have your nuclei. On your right, this example of non-keratinizing squamous epithelium is from conjunctiva. It consists of multiple layers of polyhedral squamous cells. The nuclei extend to the surface, and this type of epithelium is usually moist and found in your mucous membranes. Next image is on your left. In keratinizing stratified squamous epithelium, the superficial layers, as shown you in your single bold arrow, are composed of dead cells that have been replaced with keratin. The keratin will provide the toughness as in the skin. On your right is the cuboidal epithelial cells pointed by your arrows. These are short and square with centrally placed round nuclei. This example on your right is in the small pancreatic duct. Examples of some cuboidal epithelium include the linings of the ducts, the external surface of the ovary, and some of the renal tubules. Next image is your sweat gland duct. On your left, this sweat gland duct is lined by multiple layers of cuboidal epithelium. Stratified cuboidal epithelium is rare. On your right is a simple columnar epithelium consists of tall rectangular cells with ovoid basally located nuclei. This example is from a pancreatobiliary tree. Other examples including the lining of the gut in other large ducts. The cilia or microvilli may be present at the apical border. On your left is a stratified columnar epithelium, which is seen in some portions of your conjunctiva as well as in some large ducts and portions of the male urethra. On your right is a transitional epithelium, which is a specialized multi-layered epithelium with basal low columnar or cuboidal cells, overlying intermediate cells, and large, sometimes dome-shaped surface or umbrella cells. It allows structures of the urinary tract to expand when distended with urine and collapse when empty. On your left is the umbrella cells in black arrow, and your urothelium may be binucleate and may bulge into the luminal space. On your right, this example is a pseudo-stratified epithelium from the trachea. All cells rest on the basement membrane, but not all reach the surface. Since the nuclei are at different heights, it imparts the appearance of most stratification. Most pseudostratified epithelia are ciliated, as seen here in black arrow. Functions of this type of epithelium include secretion, absorption, lubrication, protection, and transportation. Next are the glands. On your left, these are the secretory units, and their ducts make up the parenchyma of a gland, as shown here by this example of lactating breasts. On your right, the connective tissue surrounding a gland constitutes the supporting stroma. Here, a peribiliary mucous glands are surrounded by lobular connective tissue stroma. On your left, mucous glands as seen here in this example is from a minor salivary gland. These are exocrine glands that secrete mucinogens which ultimately become mucus. Note that the secretory unit is surrounded by a connective tissue stroma. On your right, serous glands such as the exocrine pancreatic acini, as shown here, are exocrine glands that secrete a watery enzyme-rich fluid. The products of glands are often stored in secretory granules. On your left, this is a mixed serous and mucinous glands, illustrated here in a minor salivary gland. These are exocrine glands that produce both mucus and serous secretions. The distinct mucus cells in bold arrow are filled with the basophilic mucin with overlying granular serous demilunes. This is in a curved arrow here. On your right is a sebaceous glands that have abundant clear staining cytoplasm due to abundant lipid. This sebaceous gland is attached to an adjacent hair follicle which are emptied its contents into the follicle via the sebaceous duct. Next is your myoepithelium. On your left, these myoepithelial cells have features of both smooth muscle and epithelium, and they help express secretions. In this section of breast, the epithelial cells marked with keratin, such as the red chromogen, and the myoepithelial cells marked with calponin, the brown chromogen. On your right, the endocrine glands, such as your pineal gland shown here, have no ducts, as they have lost the connection to the originating epithelium during formation. They also secrete their products directly into blood or lymphatics. On your left, the adrenal gland is an endocrine gland arranged in the cords of endocrine cells surrounding capillaries. On your right, some endocrine glands are arranged in follicles or glandular cells that surround a cavity which receive the hormone. On your left, some glands such as the pancreas are mixed endocrine and exocrine. This photomicrograph of pancreas shows the endocrine islet of Langerhans surrounded by your exocrine acinar parenchyma. On your right, the granulosa cells of the ovary shown here are an example of a collection of endocrine secretory cells that exist within an organ that contains multiple tissue types. The testis, pancreas, and placenta are other examples. On your left, this is a diffuse neuroendocrine system, which is present throughout the digestive tract and respiratory tract. These cells make many different types of hormones. They are also known as your amine precursor uptake and decarboxylation. These neuroendocrine cells in the stomach are highlighted by CD56. On your right, the loose connective tissue consists of a loose arrangement of fibers with abundant ground substance and extracellular fluid that contains scattered collagen, reticulin, and elastin fibers. On your left is a dense connective tissue, seen here in the dermis. It contains more fibers than loose connective tissue. Note that the dense eosinophilic collagen fibers on the right curved arrows. On your right is the reticular connective tissue, which is composed of type 3 collagen. They form a network that makes the framework for many organs and glands. A reticulin stain shows the reticular network in the liver. They are supporting the sinusoids and hepatic cell plates. On your left, the adipose tissue, which is a type of connective tissue that stores fat. It also contains receptors for many substances, including glucocorticoids, growth hormone, and insulin. It is present in the subcutaneous tissue, omentum, and mesentery. On your right, bone is a type of specialized connective tissue that comprises the primary structural framework for the body, which is your skeleton. Its ECM is calcified and surrounds the cells that secreted it. On your left is a cartilage. This is a specialized connective tissue which is very flexible. It lines the articulating surfaces of the bones, serves as a template for endochondral bone formation, and is part of many organs such as the ear, larynx, and intervertebral discs. Your right is a skeletal muscle, which is a type of striated muscle that comprises the majority of the voluntary muscle mass in the body. The cells are long and cylindrical, as shown here in the cross section, and have a peripheral nuclei shown in blue arrows. On your left is a cardiac muscle, which is non-voluntary striated muscle which is present only in the heart and proximal segments of your pulmonary veins where they join the heart. The muscle nuclei are centrally located. On your right is the smooth muscle, which is shown in blue arrows. This is present in the walls of the viscera, such as in this example, the wall of your stomach. On your left, the peripheral nerves are composed of multiple bundles of fascicles of nerve cells which are enclosed by connective tissue known as the perineurium. The peripheral nervous system includes cranial and spinal nerves. On your right, ganglia is located throughout your body. They are the aggregates of neurons within the peripheral nervous system that contain the cell bodies of sensory and the postganglionic autonomic regions and autonomic neurons. Next image is your tissue folds. Your tissue folds are curls that are very common artifact in histology. Although large folds can be prevented with careful technique, some small folds are unavoidable, particularly in tissues with hard components such as your bone or edematous myxoid changes. On your right, air may get trapped between the slide and the cover slip during preparation. These artifacts appears histologically as sharply demarcated glassy zones and often prevents clear visualization of the underlying tissue. Next general histologic artifacts is your linear breaks, shown in arrow on your left. These are tears that may be identified in tissue sections and are the result of blade damage during microtome sectioning of the paraffin block. Sometimes these tears have a repetitive parallel appearance and have been described as chatter. On your right, the fragmentation of tissue during sectioning and processing can limit or prevent adequate histologic evaluation, particularly in small samples. On your left, a fresh tissue removed from the body will begin degenerating or otolizing if not placed in fixative. Otolized tissue is characterized by loss of cytoplasmic and nuclear detail, cell shrinkage, and overall pale staining. These findings may be misinterpreted as necrosis. On your right, a variety of exogenous contaminants may be identified in histologic sections, including pollen small fibers and other materials such as in blue arrow. Occasional bits of tissue from other specimens may also be seen as your floaters. On your left, this tissue is removed by electrocautery or similar means, showing characteristic artifactual changes including nuclear splending and pseudostratification in blue bold arrows. The affected connective tissue in single blue arrow often appears denser and amorphous. On your right, tissue containing grossly identifiable bone must be decalcified prior to processing so that satisfactory microtome sectioning can be performed. Under-calcified bone is mineralized and appear gritty and purple in blue arrows. Other artifacts such as folds and tears are also common in this setting. Special stains. On your left is hematoxylin and eosin stain, which is the standard histochemical stain used in routine histopathologic evaluation. The hematoxylin stains nuclei dark blue or purple and the eosin stain cytoplasm pink. On your right, the mucicarmine stain, sometimes referred to as the mucin stain, highlights acid mucins with a bright pink stain and blue arrows, as seen in goblet cells of the small bowel epithelium. Other mucins and background tissue will stain yellow. On your left is the periodic acid Schiff stain, which is used to highlight a variety of substances from neutral mucins to polysaccharides such as glycogen. This image shows intracytoplasmic glycogen, which is bright pink in normal liver tissue. On your right is a pre-treatment of a tissue section with diastase causes the digestion of glycogen, removing the bright pink periodic acid Schiff staining from tissues that normally contain your polysaccharide. On your left is a PAS stain, highlights neutral mucins such as those present in the foveolar lining of the stomach as depicted. As with other tissues, the staining is bright pink. On your right is the Alcian blue, stains highlights acidic mucopolysaccharides and sulfated mucins, staining them blue or green as seen in this section from a normal intestine. On your left is a combined stain containing Alcian blue and PAS, can be used to distinguish acid mucins, the blue or green, from neutral mucins, the bright pink, in blue arrows. The right image is a trichome stain differentiating a connective tissue in collagen from a muscle tissue. Connective tissue stained blue to blue or green, while muscle in bold arrows, as well as the parenchyma in curved black arrow, will stain red and pink. On your left, as the name implies, an elastin stain highlights elastin fibers, which appear black or dark purple depending upon the exact histochemical technique. These fibers are common in connective tissue. On your right, an elastic stain can be used to identify the elastic lamina in blue arrow that delineates the visceral pleura from the periphery of the lung parenchyma. This structure may be transgressed in some lung tumors. On your left is a reticulin stain which highlights reticulin fibers in black and this image of normal liver. Reticulin fibers can also be demonstrated in bone marrow and lymphoreticular organs. On your right, the Prussian blue stain highlights ferric iron when present in tissue, liver in this image. Iron appears here as small blue granules, and depending on the tissue, this finding may be or may not be significant. On your left, the rhododin stain, often referred to as the copper stain, which highlights cytoplasmic accumulation of copper. This pigment appears a distinctive rust brown in color in curved black arrow. On your right is the Jones methenamine silver stain, which highlights the basement membrane of the glomerulus. In this tissue, the basement membrane stains black in blue arrow. For the part 2 of your normal histological techniques, we will be looking at the immunohistochemistry of normal tissues and the immunofluorescence, even the electron microscopy, as we go further with the second section, which is the integument of your medical histology class. Thank you so much for watching, and don't forget to like and subscribe this YouTube channel. Have a nice day, everyone.